Imagine this. You have a fever. You go to the doctor expecting a pill, maybe some rest advice. Instead, he pulls out a blade and cuts open your arm to let the blood flow out. And here's the insane part. This wasn't torture. This was considered the most advanced medical treatment of its time. It was called bloodletting, and it lasted for over 2,000 years, from ancient Greece all the way to the 1800s. 2,000 years of doctors cutting people open, on purpose. And the strangest part? The smartest minds of every era believed in it completely. Let's find out why. No long intro today, because this story is too wild to waste time on small talk. If you think modern doctors give weird advice sometimes, wait until you hear what was considered completely normal for 2,000 years straight. Let's travel back to ancient Greece, where this whole idea began. About 2,400 years ago, a Greek physician named Hippocrates, yes, the same name behind the Hippocratic Oath every doctor takes today, came up with a theory that sounds absurd by modern standards. He believed the human body contained four substances called humors: blood, yellow bile, black bile, and phlegm. When these four were balanced, you stayed healthy. But if one of them built up too much, you got sick. And according to this theory, the most common problem was simple: too much blood. So what was the fix? Just remove the extra. This idea wasn't just Hippocrates alone. A few centuries later, a Roman physician named Galen expanded on it, turning it into a complete medical system that doctors across the Western world would follow for almost 2,000 years. Galen believed blood was constantly being produced by the liver, which meant, in his view, it could never really run out. So removing it seemed completely safe. So basically, if you had a fever, a headache, or even if you were just too angry, all of it got blamed on too much blood. The doctor would think, this body is overheating from excess blood. Let's drain some out and restore balance. This idea became so popular that for the next 2,000 years, doctors across Rome, the Middle East, and Europe all followed the exact same formula. Sick? Drain the blood. Fever? Drain the blood. Headache? You guessed it. Drain the blood. It was the one-size-fits-all answer to almost every illness imaginable. Fatigue, insomnia, joint pain, even mental illness. There was almost no condition that bloodletting wasn't recommended for at some point in history. Now, the real question? How exactly did they drain the blood? There were three popular methods. Let's go through each one. Method 1. Venesection. The first method was called venesection, simply cutting open a vein, usually in the arm or neck. The blood would drip into a bowl, and the doctor would watch closely to measure how much came out. Sometimes, in a single session, doctors would drain up to half a liter of blood, which is a massive amount for any human body to lose at once. Doctors even created detailed charts showing exactly which vein to cut depending on the illness. A headache might call for a vein near the forehead, while stomach pain might call for a vein near the foot. Method 2. Leeches. The second method involved leeches. These small creatures were placed directly on the skin, and they would attach themselves and begin feeding on the patient's blood. It sounds disgusting, but by the 1800s, the demand for medical leeches in Europe was so high that people started catching and selling them as a full-time business. In fact, leeches became so overused for medical treatment that in some regions they nearly went extinct. France alone was reportedly importing tens of millions of leeches a year at the height of leech mania. Method 3. Cupping. The third method was called cupping. A doctor would heat a small glass cup from the inside, then quickly press it upside down onto the patient's skin. As the cup cooled, it pulled the skin inward, drawing blood to the surface. Sometimes a small cut was made inside the cup first, allowing actual blood to be drawn out completely. This left behind round circular marks on the skin. And interestingly, a milder version of this practice, without any cutting, is still used today in some alternative therapies. Here's something that will surprise you. Bloodletting wasn't only done by doctors. In medieval Europe, it was also commonly performed by barbers. That iconic red and white striped barber pole you still see outside barber shops today? Historians believe the red represents blood, and the white represents the bandages used during these procedures. The pole itself is said to represent the staff patients would grip tightly during the cutting to help their veins bulge out. It wasn't even just for sick people. Many healthy individuals scheduled routine bloodletting sessions during certain seasons, believing it would prevent illness before it even started. Monks in medieval monasteries, for example, were often required to undergo bloodletting several times a year as part of their regular health routine, whether they were sick or not. Imagine going to a clinic while perfectly healthy, just to have blood removed as a preventive measure, and then walking out weaker than when you arrived. Even your social status could affect how the treatment was done. Wealthier patients often received more careful, controlled bleeding from trained physicians, while poorer patients were often treated faster and rougher by barber surgeons with far less training. And it wasn't only a European phenomenon either. Versions of bloodletting and similar bleeding-based treatments appeared in the medical traditions of the Islamic Golden Age in parts of South Asia and in Chinese medicine, where cupping in particular has a long parallel history of its own, though practiced with different theories behind it. Now, all of this might have sounded logical for the time, but the real problem was simple. These doctors understood the reasoning, but had no idea about the actual effect. They didn't realize blood is essential for the body to function. It's not some waste product that needs to be removed. So, when an already weak, sick patient had even more blood drained from their body, they often became weaker, fainted, or in many cases died. Not from their original illness, but from the treatment itself. And here's the strangest part. When a patient didn't improve, doctors rarely blamed the method itself. Instead, they would say, "Maybe we didn't drain enough blood. Let's try again." Which meant the solution to a failed treatment was simply doing the exact same treatment again, but more aggressively. Historians believe this flawed logic caused thousands of deaths over the centuries. Patients who didn't die from their illness, but from the very cure meant to save them. What's even more remarkable is that doubts about bloodletting existed for centuries before it was finally abandoned. As early as the 1600s, some physicians quietly questioned whether it actually helped. But the theory was so deeply embedded in medical tradition that challenging it could end a doctor's career. And if you think this only happened to ordinary people, here's something that might shock you. It even contributed to the death of America's first president. In December 1799, he developed a severe throat infection. Breathing became extremely difficult. Doctors were called in immediately, and their solution was, of course, bloodletting. Not once, not twice, but 4 separate times, all within the same single day. Historians estimate that nearly 2.5 liters of blood were removed that day, almost 40% of his body's total blood supply. That same night, he passed away. Today, many medical historians believe the treatment itself likely weakened him faster than the infection ever could. The cure meant to save his life may have been exactly what ended it. And he wasn't the only notable figure affected by this practice. Historical records suggest several other prominent figures across Europe were also treated with aggressive bloodletting during their final illnesses, with similarly questionable outcomes, though their stories never became as widely known. So, how did this practice that lasted 2,000 years finally come to an end? The real turning point came in the 1830s, when a French physician named Pierre Louis decided to actually test the theory scientifically instead of just trusting tradition. He studied hundreds of pneumonia patients, carefully comparing the outcomes of those who received early, aggressive bloodletting against those who didn't. His findings were clear. Patients who were bled heavily did not recover any faster and in many cases fared worse. This was one of the earliest uses of statistical evidence in medicine, and it slowly began to shift the conversation. Over the following decades, as germ theory and a better understanding of human biology developed, bloodletting was gradually phased out of mainstream medicine. By the late 1800s, it had largely disappeared from regular use, not because someone declared it banned, but because the evidence simply stopped supporting it. Patient: Doctor, I just have a small headache. Doctor: I see, that's clearly excess blood pressing on your skull. Show me your arm. Patient: But I just wanted some water and a bit of rest. Doctor: Nonsense. Science says drain the blood. Trust the process. Narrator: The headache, of course, was never actually fixed, but the patient was now too weak to stand and complain about it. And somehow this was still recorded as a successful treatment. So next time you have a fever or a headache, just take a pill, drink some water, get some rest, and be grateful your doctor isn't walking in with a blade. It took nearly 2,000 years of trial and error, and one brave doctor with a notebook full of statistics, for medicine to finally move past this idea. A reminder of just how far we've come and how important it is to actually test our beliefs instead of just trusting tradition. If you think this history was absolutely insane, let me know in the comments. And if you want more weird history like this, hit that subscribe button. I promise. We won't be draining any blood for it. Just one click. See you next time.